Okay, hello. We're going to do our presentation on lung cancer. So we're going to start off by going through some of the causes and risk factors for lung cancer. Lung cancer is actually one of the leading types of cancer, and it causes more cancer-related deaths compared to others. Smoking cause is about 85% of lung cancer cases that come is due to smoking. You can either have passive or secondhand smoke and or actively smoke, and that increases your risk. You can have occupational exposure, which is if you have like exposure to certain carcinogens like asbestos or nickel or arsenic where you work. Asbestos is usually found in insulation, and it is now banned because of its carcinogenic effects. Air pollution and like breathing in certain particulates can also increase your risk. Radiation exposure, family history, genetics can also increase your risk of lung cancer. And if you have other underlying diseases such as COPD or emphysema, tuberculosis, that can all increase your risk.
So signs and symptoms of cancer often go unnoticed. It's actually called a silent threat because of it. In its early stages, symptoms are not as noticeable. By the time symptoms are apparent, the cancer may have progressed. So some of the signs and symptoms are persistent cough that doesn't go away, shortness of breath and dyspnea, even when doing minor activities or non-strenuous activities, persistent chest pain and discomfort, um, hematophys, hemolysis, excuse me, coughing up blood. It appears as a rust-colored sputum, and recurrent respiratory infections such as bronchiolitis and other infections could be a sign of something more serious going on. At advanced stages, people experience pain in the bone, headaches, and swelling of the neck and head, resulting in superior vena cava syndrome.
There are two common types of lung cancer. Non-small cell lung cancer accounts for 85% of all lung cancer. Uh, and so carcinomas are found in non-smokers and in women. Squamous cell carcinoma usually develops in the middle lobe and is strongly associated with smoking. Large cell carcinoma is found in variable regions of the lungs. Then the second type is small cell lung cancer. This accounts for about 10 to 15 of all lung cancers and is more rapidly growing, and often the symptoms are more advanced in this type of cancer.
Okay, so now we're going to go through the diagnosis of lung cancer. So if you go into your primary care physician and if you have certain signs and symptoms associated with lung cancer, um, your healthcare provider is probably going to want to go through a thorough history and see if you meet certain risk factors such as smoking. And then they'll do a whole physical examination, like listening to your lungs. They might even have you do like some pulmonary function tests to see how your lungs are actually working. Afterwards, they can do any source of imaging if they suspect something. So you can go through a chest X-ray, you can have a CT scan or a PET scan. So if you're getting a chest X-ray, they're mainly looking um, at tumors or in masses. And then if you're going through a CT scan, here in this figure, we can see um, one is a transverse view, and then the other figure B is a sagittal view. And so here we see the blue is showing a actual nodule, and then the red, which are the smaller ones, are showing the satellite nodules. And usually we would see these lungs be mostly black because they're full of air. So that's how you know what you're looking at and that these are the nodules. And in figure B, it's the same thing. The blue shows the actual nodule along with the red being the little satellite nodules. And so after a CT scan, you can also get a PET scan to see the progression of and to see if the cancer has gone to other places in your body. You can also go through, and if you once you suspect cancer, you can go through a biopsy. And so you can do a needle biopsy, which is they actually get a needle and they insert it into your chest wall, and they actually get a sample tissue of your lung. Or they can go ahead and do a bronchoscopy, which is when they stick a scope down your nose or your mouth, and they go and try to see if there's like a possible tumor. And at that point, they can also collect a sample. Um, and overall, in the diagnosis process, early diagnosis increases your chances of recovery.
Okay, so treatment is usually dependent on the person itself, so it's very specific, dependent on cell type, stage of disease, and physiologic status. And treatment could be a combination of things. It could be chemo, immunotherapy, surgery. For non-small lung cancer, surgery is usually the main option, so that involves lobectomies, removal of the lobe of the lung, pneumonectomies, removal of an entire lung, wedge resection, removal of a small portion of the lung, segmentectomy, removal of a larger portion than a wedge resection, but less than a lobe. And for small cell lung cancer, it is usually spread, metastasized. So we have radiation therapy. Um, we could use external beam radiation, which targets radiation from the outside of the body, or internal radiation therapy, which delivers radiation near the tumor. There's chemotherapy. There's many types of chemotherapy. There's systemic treatment, drugs that circulate throughout the body to kill cancer cells. Adjuvant chemotherapy, usually given after surgery is done to eliminate any remaining cancer cells. And there's neoadjuvant chemotherapy administered before surgery to shrink the tumors. There's also immunotherapy, which is basically referred to as checkpoint inhibitors. Indication for treatment is usually on stage 3 tumors, and it basically programs cell deaths with certain proteins and prevents T cells from attacking other cells of the body. And sometimes the cancer is too far gone. That's when we implement palliative care. So for this, we really want to focus on comfort for them. Pain meds, radiation to reduce tumor size and uh, release pressure off some of the other organs of the body, and just general comfort.
And prevention. So in some cases, in those who genetically or their family history will just be more prone to lung cancer, they can still try to prevent it by staying away from tobacco or smoking entirely if they haven't stopped already. And then, as well as staying away from secondhand smoke, because that could be just as dangerous as smoking itself. Another prevention would be to avoid radon exposure. So radon is an odorless gas that comes from the rock, soil, and the water around us. This can come from our houses or the buildings in the foundation if there was any cracks in it. So you should have your home tested for these. And although the radon will take a while to build up and cause harm to us, we should still try to avoid it. And then living a healthy lifestyle, of exercising regularly and having a well-balanced diet, as well as keeping good fruits and vegetables in our diet, will help prevent lung cancer.
Okay, now we're going to just go through 2 NCLEX questions for review of lung cancer. So I'll go ahead and show you the question, and then I'll show the answer on the next slide. Okay, and if you answered D, that is the correct answer. Again, here's question 2. And if you answered A, B, C, and D, that is correct. And these are our references. Thank you.